Welcome, folks, to Pet's Best Friend. I'm Sam Lesante, your host. The main man here is veterinarian expert Dr. Kathio, located in Pittston, but has an office in Wilkes-Barre, Pennsylvania as well. You could always contact a good doctor at 655-241-2412. That's in Pittston, and Wilkes-Barre is 824-9390. My good friend, Dr. Kathio, how are you?
Thank you very much, Sam. I'm fine. Thank you for asking. How's everything with you?
No use complaining. Who's going to listen? I could list, I'll give you all my complaints. Yeah. How are you doing with God's special creatures?
Very good. Yeah, I'm loving them. I worked last night till 4:30 in the morning.
Yeah, it's, when I tell people that, they say, what about this Kathio guy? I said, well, first of all, his first and foremost love is of animals, okay? Unfortunately, sometimes veterinarians, good veterinarians like you, doctor, get a bad rap because they're always, I hear, oh, but they're expensive. They only want to rip you off, et cetera, et cetera. I think any veteran who's worth his salt is fair, okay? And you've always been that. I think those veterinarians who take advantage of people should be ashamed of themselves, first of all, because we all love our animals. I know how much I love my little Bichon, Gucci, and they become a part of your family no matter what kind of animals, except snakes that I understand you're going to have on the show today. Yeah. Now, you know I don't like snakes, but we'll talk about this after the show. Doctor, tell me again, for people, because we are expanding our viewership here all the time. People may not even know who you are, but veterinarian medicine, what should a person do in taking care of their pets? I know this is a typical question I ask you, but we have new viewers who are saying, well, I'm thinking of getting a pet. How do I take care of my pet? When should I see the veterinarian? All these different questions.
Sam, I can sit here and talk 5 years and would not stop. But first of all, veterinary profession is a very respectful profession, and we try not to take advantage of people or we try to shame ourselves or something. We are very kind toward the animals as well as the people. And there are certain issues that happen in certain seasons. Like today, I have a cat. I would show it to you. What happens when the summer comes in Pennsylvania regions, we let the door open, we let the window opens. Our pet sneaks out, and of course, he or she going to defend their territory. Some other animals are likely to come in your backyard and greet your pet, so there might be a fight. Just like Italians,
Yeah, that's right. You could say Pakistanis, no Italian.
Yeah. So there's a fight, and when you hear a cat fight, and if a cat is in a fight or something, examine your cat for some wounds. The wounds may not be visible on the same day the cat was in a fight, but as the time goes by, you will see animals' gait or animals' posture is a little bit different. What happens when there's a puncture in the skin or in the flesh, while the one cat is biting another cat, it is beside puncturing, it's also delivering a bacteria, especially the cat bite.
And we're going to show that.
Yeah, Pasteurella multacida.
So we should be careful about our windows, our doors, etc. in the summertime?
Correct. And also you should be, if you suspect your cat might have been in a fight or something, take it down to the veterinarians. If the problem is addressed early, then the treatment has a very good outcome. But if you have waited a couple days, the body will violently react to the bite and to the bacteria that has entered into the body, and in turn, with all those reactions, the pus started to accumulate into the tissue, and the tissue is going to starting to rot. It could be skin, it could be muscles, or it could be a bone or something. Then we are in a situation to manage that particular case extensively, and it's also going to hit your pocket a lot. I will show you a cat that was in a fight, and if you put this on, I can.
You want to put that video up, Andy? This is the cat that's in a fight. Folks, make sure you get.
See, you can look. We are looking at the cat's two legs. Look at the cat. One leg is very swollen, and the cat is passed out due to a shock because it's developed a huge pus and has become a septic. Look at after shaving. We can see the bite marks and surroundings, the huge swellings, seems like my arm that thick. You can see this was all covered in a pus and there was a lots of damage into the tissue. I have to do the surgery on him, and you can see after 24 hours effectively managing the problem, the dying cat is back to the life. And if it was treated earlier, it could have been just with a simple wound cleaning and antibiotics. We could have fixed that problem. But we waited for a long time, and that.
This cat was bit by what?
Another cat in a cat fight.
Yeah, it was a cat.
It's very
fight.
common.
Yeah. So what we should be doing with all our pets, okay? First of all, at least once a year they should go to a veterinarian to get checked, correct?
Yes, every 6 months is good, or at least once a year.
Yeah. And reasons for that is just like we go to the doctor.
Yeah, correct.
And then I know we have some other things, a cat with urinary infection, but when you're talking about, I often have people say, I want to buy a dog or a cat or a parakeet or et cetera for my kids. I want to buy a pet, and they're thinking about, well, what should they buy? Once again, your advice before we get a pet should be what?
Before you buy a pet, you have to learn about the pet, learn about their well-beings, learn about the veterinary costs, learn about the housing, learn about spending some times with them. If any of the above is not met, you will have a problem. And some people, when they see a puppy and they just go and buy, and when the novelty is over, they dump it into the shelter. And let me tell you the data of the shelters all over America. Like less than 10% of the animals are adopted. If you have a number of animals, and less than 5% cats are adopted. Other animals, they end up in the shelter, usually they are euthanized. There are no-kill shelters, but they have a disadvantages too. They have like 5-6 places. They fill it up, and when you take animal to them, they just keep rejecting. And these shelters, get the big name, well, that's a no-kill shelter, but also turn-away shelter as well too. Whereas full-service shelters like SPC of the Luzerne County is a full-service shelter, means they do not turn anybody away. Like people do when the no-kill shelter has turned an animal away, they take him in the woods, unleash it, and just let him go in the woods, and they do not know how to survive. So we should also give a credit to the full service shelter like SPC of the Luzerne County that is stopping the misery of killing.
I think that advice is the most important advice for anybody who is thinking of buying a pet.
Correct.
Know about the pet you're going to purchase. What you have to do to take care of that pet. Know about the veterinarian cost that you have to be involved with. Know as much as you can. Some people buy them, they become pieces of furniture. They don't give them the attention. I think people think that animals are just like pieces of furniture. They require love too. They require some involvement. Don't you think so? I mean, you love all your animals.
Yeah, even me in this age require attention and love as well. So can you imagine the pet,
Folks, the main man here, Pet's Best Friend, how long have we been doing this show? 10, 12 years?
15 years.
Oh my goodness, 15 years you've been doing this. I remember when we first started, he had all his hair, I had all my hair. We've learned a lot so far with all these shows, Pet's Best Friend. When we come back, we're going to show you some additional things, a dog with an eyelash, a hamster who had a tumor. And I don't really care about the next one, the sick snake. I could care less about that. However, there are many people that like snakes. What could I tell you? Stay with us. It's Pet's Best Friend with Dr. Anaya Kathio. He is the main man. You can always contact Dr. Anaya Kathio, world-renowned veterinarian at 655-2412 or 821-9390. In Wilkes-Barre, you give what? You give neutering or?
In Wilkes-Barre, we have a low-cost spay and neuter clinic for cats.
Okay. Low cost.
Spay and neuter clinic for cost. That's a night hospital, and if somebody comes after 8 o'clock to midnight or 2 in the morning, whenever I'm there, we do not even charge the emergency fee because after the hours, there's a heavy emergency fee. What it does, in some people, it turns they turn people away to go to the veterinarian because you walk in, there's a $150 like emergency fee you have to pay for it, and they hardly have $100 or something. So in my Wilkes-Barre Hospital for casualties, I do not have an emergency fee for that. So my community people, if they have any animals, they can bring it out. However, we do charge from 8 to midnight, but depends. If I have many animals, I wait there. Even 4 o'clock in the morning, I do it before I go home.
God bless you. Yeah. And I've seen some times where you've sat there with a cat all night, throughout the morning, early mornings, to make sure that cat was going to survive, or a dog. Have you done that? And some people think, I remember mentioning that one time. They said, he doesn't. I said, he does it. I got to mention one thing. When we showed the video, we're going to show a couple more videos of you repairing dog. But we in your office, you have a refrigerator there.
Yeah.
And so one lady said to me, "What does he bring his lunch there? Does he keep his milk and his sandwiches?" And I said, "No, he keeps all his medicines in there that have to be refrigerated," which is funny.
Yeah, especially vaccinations or certain medications. Yeah.
So no, folks, that refrigerator has important medicine in there. All right, now we have a cat with a urinary bladder. So Andy, let's put this up, and it'll tell you what we did with this particular cat.
This particular cat was brought to me, was lethargic, not eating. Look at the nose, it's all white and it's all pale or something. The primary problem was presented as a lethargy and a weakness, not eating. The cat was so weak. I examined the cat. I found out this cat, was losing blood from somewhere, and was losing blood very rapidly. Was not showing any sign of any problems. When I started to examine the cat and look at that we call a capillary refill time was greater than 3 seconds. So it went down quickly. I was examining him, and I felt a mass in the abdomen, and I found out that mass happened to be a urinary bladder. And then I was squeezing the urinary bladder. I feel the gritty things in that one. I found out this cat had a old urinary bladder infection, and the bladder was losing the blood, and the blood was going out in the urine. And since there was a kitty litter or something, it wasn't shown up. Normally, the animal in this stage will show the incontinence, or will urinate outside of the litter box, or show any discomfort going to make urination. But look at those stones that I'm showing it to you. They are packed. They are even packed in the male urethra. And here's the male urethra over there. It's all packed with these stones, but the cat was not showing in a sign of thing. So it was very unusual and challenging case. And once we performed the surgical procedure and removed those stones, the blood starting not to waste or something, the animal gained its.
So that's how you really detect that.
Yes, it was very unusual, very unusual.
I think you called me up on that. You wanted my advice on that, didn't
you?
I
did.
You said, "Sammy, this is Anaya Kathio. I have a cat."
And I also called Father Paul for some holy water to bless the cat.
All right, now what about this dog and his eyelash? What's going on with this dog?
Yeah, this dog, you can see there's extra eyelashes. The eye was getting infected, and this eye was totally displaced, located in an unusual part of the globe. There it is, and it was getting infections over and over again. Instead of putting a medication all the time in this ear, we get rid of the problem. How we get rid of the problem? Perform the CO2 laser surgical procedure. It took less than 5 minutes, and the problem of months and months, it disappeared in 5 minutes. You can see the hairs have disappeared after performing CO2 laser surgical procedure. And the dog is starting to wake up now and try not to stay still, and so we can take his picture. Or do his video, but you can see the pack of hair that was.
Oh my goodness!
They were located on the eye. So that tissue, we got rid of the whole bed, which produced hair. It is also called dermoid. And was able to, without losing a drop of blood. And other thing, when you perform a surgery with the CO2 laser, there's no post-operative swelling.
Yeah. You know what fascinates me, Inaya, with veterinarians is the fact that when you animals can't say I have a pain here, and every time so you have to they could say I don't know he's being lethargic or he won't eat or she won't do this, etc. But and I admire I guess any doctor what you do because you have to find out what's wrong with that animal. Okay?
Exactly. Just see the example of the cat was lethargic and was anemic. The cat did not tell me what was wrong. Why cat wasn't telling me she was losing the blood and all those things. But
Don't you you mean you never had an animal who talked to you? They never said, "Hey, doc, I'm having a pain in my stomach." They never talk to you. No talking animals, doc.
Yeah, they're talking animals like parrots. They talk to
right,
you. Yeah.
How about you operated on that fish that time?
Yeah, I did. Yeah. I did.
You operated on a fish. I didn't believe it until I saw how you did it with the fish. It was amazing. All right, now do we have enough time? Yeah, we have one more. We'll come back. We have some more. Here is a hamster that had a tumor, right? And you want to put that one up? This is.
Yeah, look at this hamster. They are prone to tumors, and you have to have special skills, and you have to do with these beautiful small creatures, to learn about them. And look at I removed this tumor with the CO2 laser. And we also have services to provide to the exotic animals. Sometimes it's very difficult to find a veterinarian that would do these little guys. They are, look at it, how big it was,
What was that?
That was a tumor known as melanoma.
Yeah, oh, wow. Was it cancerous?
Yeah, but we took care of it. It never grew back,
okay.
That was good. It was a big,
How long do hamsters normally live?
They live a few years, not too long. Not too long. Yeah,
but they're still pets, and
they're pets. People enjoy them, you know.
Yeah.
They are lovable, They are lovable, and they teach you lots of things,
Yes, they do.
Yeah.
That's a good point. Animals do teach you a lot of things.
Yeah.
They really do. I mean, if you look at them, and they really teach you a lot. Folks, I'm talking to Dr. Inaya Kathio. The show is called Pet's Best Friend. We've been doing it for 15 years. His phone number is 655-2412. And don't forget the spay and neuter clinic, the low cost in Wilkes-Barre. He's there from 8 o'clock to 12 o'clock. I don't know when he sleeps. That's 821-9390. We come back, we'll talk a little bit more about the doctor, and I'm not really too happy to show you what the next pet is, but I have to show it to you anyway. Stay with us. Welcome back to Pet's Best Friend with my main man, Dr. Inaya Kathio, world-renowned veterinarian, and his office is in Pittston and Wilkes-Barre, 655-2412, folks. And don't forget Wilkes-Barre, the low-cost spay neuter program he has from 8 o'clock to midnight. Very seldom does he charge you for any emergency calls at 821-9390. Doc, before we show this disgusting other film that you have that you took, and I don't like snakes, and you brought a snake anyway. What's wrong? You don't like me or what?
I think snakes are very neat pets.
Oh my gosh. Folks, let me get this out of the way here, okay? I really hate snakes, period. But there are a lot of people who really enjoy them, right? I mean, it was amazing how many people. Tell me about snakes. Why do I hate them?
Before I go to snake, I would like to advise to our viewers that emergency can happen anytime and anywhere.
Yes.
And an emergency does not see calendar. So what happens sometime a dog breaks its bone or develops, ruptures a tumor, or develops some uncertain condition like a bloody diarrhea or blockage or something. Now these people are not prepared to pay the veterinarian.
Yes.
And so I would advise them, like if you have a pet, try to save some money, so something happens, God forbid something happens, so you have some money or means, or get a credit card or Visa card so you have that thing available to you. Now, when they come, already they are frustrated, their animal is sick, they do not have the money. And the veterinarian gets blamed that we are outrageous. We charge so much money, and why do we have to pay thousands of dollars to pay for all those things? We are not taking the money in. We are doing services to the people. We have emergency clinics in the town. We are fortunate in Luzerne County. We have emergency clinic. It is a very good service. They provide it to them 24 hours. Now there are doctors working, there are nurses working, they have to maintain the equipments and all those things. And all these things add up to the cost that we have to be fully prepared. When your pet comes to us, we give them the standard care. So And people, have to understand that when they are paying a veterinarian, they are not giving money to the veterinarian. They are paying for their pets to get better. Now we come to the snake.
Oh, wait, let's stay on that. You're so right, because some people, times are tough, and there are people who are just trying to maintain their own livelihoods, but if an emergency happens, you should always be prepared. Give you a call, and you've always been good with that. Okay, now let's talk about the snake, and then I'll talk about other things about snake. So what happened? Throw this film up. Let me get. Oh God.
Yeah, snake, like other animals, they have a tendency to get sick. In this particular snake, it developed swelling on the body, all over the body. And I examined him. I found out this animal was accumulating some type of fluid, most likely the blood. Sometimes they hemorrhage the snake. Sometimes we get the snake that has been fed a rat that has been, or mice that has been given a warfarin or anticoagulant or something. If these animals ingest those things, they're starting to bleed themselves. So that is one of the, when you can see, I'm removing the unclotted blood between the skin and the muscles of a snake to give him a relief. So, this is a ball python, and if my advice would be to people, if you feed pinkies or you feed a small rats to the snakes, find some reliable sources and give it to them, because if that animal has some kind of chemicals in it, especially the anticoagulant, and if your snake is going to eat that one, or sometime, there are some loose aspirins or something, and on the floor, then the snake is walking around and ingesting those medicine or something, it can make them bleed internally as well. They are really a beautiful pet. They are.
Ask me if I care now. Ask me if I personally care about that snake.
That is
I could care less about that snake.
That is a typical things that we learn in the world. When we are born, we are angel. We learn about hate in this world.
I'm not hating. I just don't like snakes. I just think they're evil.
Yes, the environment sometimes it can teaches you some very negative. Yeah.
Why these people? First of all, you gotta be careful with snakes. Okay, all kidding aside, you gotta be careful, because sometimes they bite you, or I don't know if that's these pets. Sometimes I don't understand that.
Most of the pet snakes, they are non-poisonous, and they can bite you. Of course, they can deliver the bacteria, especially Aeromonas. It's very common in their mouth, and you wash the wound immediately and take the antibiotics, and most likely you'll be better.
You are a true veterinarian.
Yeah,
let me tell you. You are definitely a true veterinarian.
Yeah, let me tell you one thing. One lady called me, and she was so angry. Called me, said the dog bit me. A dog bit me. I'm worried about it. I said, I told her that, what are you worried about? Are you worried about the dog, that he might get a disease from you or something? That lady did not like it.
No, she didn't like it.
I said, you're calling me. I'm a veterinarian. I have to take care of the animals. I asked her, are you free of any diseases, so the dog does not get I told her the dog had the rabies and was up to date with the shots. These things can happen, and just go see your physician. She wanted to ask me if I could
see, that's a popular area. You wanted to find out what's going on. She probably thought you were a wise guy.
Yeah, she did. Yes,
folks. Anyway, folks, I'm talking to Dr. Naya Kathio. All kidding aside, world-renowned veterinarian. If you have any questions about your pets or something you should do, 655-2412. And don't forget that low-cost clinic he has in Wilkes-Barre from 8 to 12. It's 821-9390. And you can always go to his website, or go to our website, ssptv.com, hit Pet's Best Friend, and you'll see all about Dr. Naya Kathio. Well, Doctor, it's always a pleasure.
Thank you very much, Sam Lesante.
Okay. We'll see you next time on Pet's Best Friend.